Adherence to the COVID-19 preventive protocols has been the bane in the country's fight against the pandemic. With the country recording the Delta variant and challenges in Ghana securing vaccines for its citizens, there are fears of a third wave. In this report, our Ashanti regional correspondent Beatrice Spio-Garbrah looks at the hand-washing protocol, which seems to be dying out.
3 pillars for the prevention of COVID-19 were adopted by the World Health Organization. They were and are the wearing of nose masks, periodic hand washing with soap under running water, and observing social distancing. In the first press release issued by the Ministry of Health and signed by the Health Minister Kweku Agyeman-Manu announcing Ghana's first COVID cases, hand washing was the first preventive protocols among other measures. Demand for Veronica buckets increased as donations to health facilities and schools had Veronica buckets included. Veronica buckets were seen in front of shops, corporate organizations, eateries, transport terminals, markets, and other strategic places. Hand washing under running water was gradually becoming the order of the day, as the young and old would be seen washing their hands. Metropolitan, municipal, and district assemblies were tasked to form committees that would ensure all persons adhere to the safety protocols as the President directed the Ministry of Local Government and Rural Development and Transport Ministry to spearhead it. But it appears there is a laxity in enforcing the safety measures, especially that of hand washing. It is obvious members of the public are losing interest in the washing of hands.
I think now the COVID updates and whatever issues has been washed away. It seems COVID is no more.
Beginning, we were very much interested in washing of our hands. When you go to the banks, when you go to the shopping malls, wherever you enter, you have to wash your hands. It was something mandatory. But now, I don't know, it's like it's for fun, because we get there and there is water, there is no soap, or there is the bucket, but there is no water to wash your hands.
Well, I don't see any Veronica buckets around as compared to the old. And then even our president, that is Nana Akufo-Addo, is not coming on air to give us warnings as to how to wash our hands, to use the hand sanitizer and all that. And so I think by so doing, I think the government should make us all aware.
As of June 27, Ashanti region had a case count of 15,978 with 253 deaths. Ashanti Regional Health Director Dr. Emmanuel Tinkran spoke on the low interest in hand washing.
But it seems that the momentum died down, and we don't see the Veronica buckets anymore. If it's there, you can see it's old and ragged, and no water, no soap. So it doesn't motivate people to use it. So I believe that these are some of the gaps that we need to close.
Ghana has recorded over 95,000 cases of COVID-19 with 796 deaths. A virologist at KCCR, Dr. Michael Owusu, suggests the National Commission for Civic Education (NCCE) and the Ghana Health Service collaborate in stepping up education on hand washing. A public health law should also be enacted on hand washing and enforced in the quest to achieving quality health care for all, with or without COVID-19.
And I also believe that, the law that we have in place should not just be a law for COVID era, but then we should be able to extend this even beyond COVID to make it more of an enforcement that these Veronica buckets will have to be advantage places because it protects lives. And the objective of, I believe, the government of Ghana is to ensure that we have quality health care for all manner of people.
Beatrice Spio-Garbrah, TV3, Kumasi.